Okay, so my video is about John. He's a 5-year-old child with Down syndrome. So if I were to refer him, I would obviously talk to his parents because they'd be in the room with him. And this is basically what I would say. So first thing is that, you know, when you look at everything with John, he is, he's younger, he has Down syndrome, and with Down syndrome, a lot of things come into play. So he had congenitally missing teeth, misaligned teeth, smaller teeth are common in Down syndrome, even though it wasn't listed. Things like higher risk for gum disease, and their bite might be off or wrong, and that can cause a lot of perio problems as well. And even though he's 5, you want to do preventative dentistry to make sure that a problem doesn't arise. So with that being said, not that a general dentist can't help, but going to a pediatric dentist would be more ideal, just because they offer also an environment where a child like John would be more comfortable. So if we were to refer him, we would write a referral and he would show up at a pediatric dentist. They would probably do an exam. We would send over the x-rays, so they'd already have the x-rays, and then they would kind of look to see all the congenitally missing teeth that he has, maybe some ortho that they might have to help with later on, maybe not necessarily right then. They would probably have more frequent visits, especially when he gets older, to prevent from having gum disease. And then also just the area, most pediatric dentists are an open bay concept rather than general practices where they have rooms or maybe cubicles or things like that. So then, like a good example of a pediatric dentist office that I've been to, you walk in and all the chairs are in a big circle. There's TVs on the ceiling, there's toys, there's a play area with stuffed animals and books, there's a quiet room over to the right, and it's all aquarium themed. And it's just really cool for the kids. Like, they think it's awesome, like they're at a fun place to be, rather than, most dental clinics where the walls are all the same color and everything's very clean looking and it's not very fun looking. So that's a benefit. And then, a lot of the professionals there, they not that we don't, but they're like trained in being with kids 24/7, so they understand the lingo and how to talk to the kids, and they have a lot of cool fun things that they can do with them. The doctors are more trained because they're more specialized in special needs kids and pediatric kids and Down syndrome and things like that, and just kids with a lot of high anxiety, especially with John, as well as him having respiratory problems and cardiac problems. He might get stressed very easily. So with that being said, it would be ideal for John to go to a pediatric dentist.